Ever wonder what's really going through your doctor's mind during your appointment? Today, we're pulling back the curtain on what healthcare workers actually think about their patients. Some of these might surprise you. They're not judging your lifestyle, mostly. Let's start with the big one. That doctor asking about your alcohol intake or exercise habits, they're not silently judging you. Healthcare workers see hundreds of patients with similar issues every week. They've heard it all and then some. What they care about is helping you get better, not scoring your life choices. And however, there's a difference between being honest about unhealthy habits and being combative about treatment. Doctors respect patients who say, I know I should exercise more, but I'm struggling far more than those who insist their WebMD diagnosis is correct while dismissing professional medical advice. The patients, they remember forever. Ask any nurse or doctor about their most memorable patient, and they won't talk about the easy cases. They remember the patient who brought them coffee during a brutal night shift, the elderly man who told jokes despite his pain, the anxious mom who trusted them with her child's care and sent a thank you note months later. They also remember the difficult ones, but not for the reasons you might think. It's rarely about medical complexity. It's the patient who screamed at the receptionist, then demanded special treatment. The one who refused to follow post-op instructions, then blamed the surgeon when things went wrong. They root for you more than you know. Here's something beautiful. Healthcare workers genuinely celebrate your wins. That nurse checking on you at 2 a.m., she's genuinely happy when your fever breaks. Doctors often think about challenging cases long after their shift ends. When you get better, when the treatment works, when you walk out of the hospital on your own 2 feet, it makes their entire week. One ER nurse shared that she keeps a mental list of comeback patients and people she thought might not make it who surprised everyone. And those stories fuel them through the hardest shifts. The good patient? Myth. Here's a secret. There's no such thing as a perfect patient. What healthcare workers appreciate is honesty and effort. You don't need to pretend you've been following your diet plan perfectly. You don't need to minimize your symptoms because you're worried about wasting their time. What makes a good patient? Someone who shows up on time, brings their medication list, asks questions when confused, and treats the staff with basic respect. That's literally it. You're not expected to be a medical expert or never complain about discomfort. What actually frustrates them? Let's be real. There are things that drive healthcare workers up the wall. Topping the list, patients who demand antibiotics for viral infections. No matter how many times they explain that antibiotics don't work on viruses, some patients insist they always get antibiotics and refuse to leave without a prescription. Another big one? The doorknob confession. That's when a patient waits until the doctor's hand is literally on the doorknob to mention chest pain, suicidal thoughts, or some other critical symptom. They've spent 15 minutes discussing minor issues, and now drop a bombshell as the doctor is leaving. Ignoring medical advice, then showing up later with complications is also high on the frustration list. If your doctor tells you to finish the entire course of antibiotics or avoid certain activities after surgery, there's a reason. When patients don't follow instructions, then return angry that they're not healed, it creates an impossible situation. They notice everything, but choose their battles. That smell of cigarette smoke on your clothes when you said you quit smoking 3 months ago, they noticed. The defensive body language when they ask about stress, they see it. The contradiction between what you're saying and what your test results show, they caught that too. But here's the thing, they're not the health police. They pick their battles. If you're making progress in other areas, they might let the small fibs slide. They know that change is hard and perfection is impossible. What they won't ignore is anything that could seriously harm you or interfere with your treatment. The emotional toll you don't see. Healthcare workers maintain professional composure, but they're human. The patient who died unexpectedly haunts them. The family member who screamed accusations stays with them. The child they couldn't save breaks their heart in ways they can't show at work. Many nurses and doctors have specific patients they think about years later, wondering what happened to them, hoping they're okay. They remember your stories, your families, your fears. They just can't let you see how much it affects them because they need to stay functional for the next patient. When they're genuinely impressed, healthcare workers are impressed by resilience, not perfection. The diabetic patient who's really trying to manage their blood sugar, even if the numbers aren't perfect yet. The chronic pain sufferer who stays positive and works with the treatment plan. The elderly patient who does their physical therapy exercises every single day. They're also impressed by patients who advocate for themselves appropriately. There's a difference between, I don't think this medication is working for me, can we discuss alternatives? And I demand you change my prescription immediately because I read on Facebook that this drug is poison. The truth about Dr. Google. Doctors don't hate that you Google your symptoms. What they hate is when you trust a random forum post over their medical degree and years of experience. They're happy to discuss what you found online and explain why it might or might not apply to your situation. The best approach? I was reading about my symptoms and came across information about X condition. Can you help me understand if that's relevant to my situation? That opens a dialogue instead of creating a confrontation. What they wish you knew? Healthcare workers wish you knew how much they care. They wish you understood that insurance companies and hospital administrators create many of the frustrations you experience. Not them. They wish you'd speak up about symptoms earlier instead of waiting until things are severe. Most of all, they wish you knew that they're on your team. When they ask hard questions or recommend difficult treatments, it's because they want you to have the best possible outcome. They're not trying to make your life difficult, they're trying to save it or improve it. The small gestures that mean everything. You might think grand gestures matter most, but healthcare workers treasure the small things. A simple thank you at the end of an appointment, remembering your nurse's name, being patient when they're running behind because of an emergency, bringing in a box of cookies for the staff during the holidays. One doctor shared that a patient once apologized for taking up too much time during a complicated diagnosis. He told her, "This is literally what I'm here for." That moment of mutual understanding and respect, that's what they live for. They don't expect gifts or elaborate praise. They just want to feel seen and appreciated as people, not just service providers. Another thing that touches them? When patients take their advice seriously and it works. Nothing validates their years of training like seeing someone implement lifestyle changes and come back months later healthier and happier. Those success stories fuel their passion and remind them why they chose this career. The patients who make it all worth it. Despite the challenges, healthcare workers continue because of you, the patients who make it worthwhile, the ones who say thank you, who follow up with how much better they're feeling, who trust them during scary moments, who treat them like human beings doing a difficult job. Every genuine smile, every successful treatment, every life saved or improved, that's what keeps them coming back shift after shift. You're not just a case number or a diagnosis. You're a person they're trying to help, and when it works, there's no better feeling in the world. And they also appreciate patients who understand that medicine isn't always black and white. Sometimes diagnoses take time. Sometimes treatments need adjustment. Sometimes the answer is, we need to monitor this and see. Patients who can handle that uncertainty without becoming hostile make the job infinitely easier and more rewarding. So next time you're in that exam room, remember, your healthcare team isn't judging you. They're cheering for you. They want you to get better, stay healthy, and live your best life. All they ask is honesty, respect, and a little patience. Because at the end of the day, you're both working toward the same goal, your health and well-being. If you found this eye-opening, hit that subscribe button for more insider perspectives on health and medicine. What's your experience been with healthcare workers? Drop a comment below. We'd love to hear your stories. Thanks for watching, and here's to better understanding between patients and the people who care for them.